3 years ago, we had similar programs like this. I know, Chief, you've been involved with programs like this even longer ago. Has this overdose epidemic really worsened during the pandemic?
I recently had an article in the paper in Malone where I've never seen it as bad as it is right now. We had 5 fatal overdoses of fentanyl in the last 4 weeks, 1 in the village, 4 outside of the village. Completely unheard of in a small community like ours. It's just that we're battling the drug epidemic, and it seems like everywhere we turn, there's cocaine, and sometimes cocaine laced with fentanyl. We're not running into the heroin like we were 6-7 years ago, but I've never seen so much cocaine as there is now. I talked to one of my friends who's a detective in Plattsburgh, and they're seeing the same thing here. Lots and lots of cocaine. We're actually starting to see some crystal meth, like the real crystal meth as well. It is just like I've been a police officer almost 29 years, and I've never seen it like this before.
Rheannon, is it primarily that we're seeing fentanyl getting into the streets? Is it that becoming much more of a problem than the typical traditional opioids that we were talking about years ago?
Yeah, so in the syringe exchange locally and then in our exchanges in the 6 counties that we're in right now, we are primarily seeing fentanyl. We don't see very much heroin. We don't see really any pharmaceutical prescribed medication pills. We're really just seeing a lot of meth, a lot of cocaine, crack, and typically it's always laced with fentanyl. So at our program, we have fentanyl test strips that are readily available to anybody that needs them. Community members and then businesses and organizations request fentanyl test strips from us all the time. So we'd be happy to distribute.
Jared, Chief Premo talked about the situation in Malone and surrounding area of Malone. 5 deaths in the last month is just so tragic. Are we seeing similar spikes in communities around the North Country?
Yeah, I mean, Rheannon probably speak to the statistics of that a lot better, but I can tell you from a standpoint of a treatment provider, the amount of overdoses that people are reporting when they come to treatment has increased pretty significantly. We had somebody that had left us and came back a month later that had overdosed 6 times over the course of that month, you know, and it's more common now than it isn't.
Zachary, one of the quotes that's in the film that sort of struck a chord with me was when Ronnie, Narcan Jesus, mentioned that aloneness is a major driver of these addictions. How do we approach that as being an issue?
Yeah, so I think it was Chasing the Scream is a book. I can't remember who the author is. Anybody remember? No, it's a good one. You guys should read it if you haven't. But what they talked about there was that they referenced the antidote to substance use, to addiction being connectedness. And that's really what we're talking about here, right? And the terrible part was when the pandemic hit, COVID, what was the one thing we were told to do? What was the safest thing we could do? Was isolate ourselves. So we already took a group of people that struggle with wanting to do that and recognizing that they need people around them, and we asked them to isolate for their safety. And we see a spike. And I don't think that should be a surprise. We just need to recognize that we've exacerbated that situation. And if you want to talk about community, just how many times in that movie that we just watched did they reference and refer to themselves as a family, right? And you know, you think about the different, the heritage that we have in AA and NA, it's really a family model, right? And it's talking about connectedness. How do we see ourselves in each other? How do we identify and find common ground and learn how to relate with each other? And how do we just accept each other, right? You know, the fact that they're willing to snag, who was it, Ron in the wheelchair, right? Think about the relational aspects of having to give up your one mode of transportation to a stranger, right? There was a connectedness there. And I think that's really what we're talking about is it doesn't have to be complicated. It doesn't have to necessarily be a treatment program. It needs to start at a very visceral level, which is just seeing each other as we are, inherently priceless, in my opinion.
Thanks, Zachary. Mike, the kind of support that we're talking about is so critical, and it's the kind of work that you focus on at MHAB. But how are you able to deliver that? What are the keys in terms of being able to really work with someone who's going through his own demons and going through his own recovery, and provide the kind of support for that kind of fresh start that you really want to be able to help lead them to?
Well, thanks for the question, and thanks to PBS for putting this on and for everybody being here. And, we opened MHAB a year before the pandemic hit, so we had a very limited amount of time to kind of experience getting people out and the connectiveness. And I love what Zach said about that, and I've heard that often, that the opposite of addiction is connection. You saw it in the film, and I think when the pandemic hit, which is how you originally started this question, and everybody went to isolation, we had many residents who came to us and said, please don't shut the recovery center down. Please keep 12-step meetings going on. Please allow us to gather in there. I don't think I can live if I don't have that support. Thank God Clinton County was understanding and allowed us to keep some of our meetings going on, albeit with limited numbers and precautions, and we did things like that. But it's so important. And part of the issue, MHAB has close to 100 residents most of the time, and we've tried to provide everything that they will need to find their way into long-term recovery. And just getting them to leave their room and go to the recovery center and talk to a peer advocate or come to a meeting can take an act of Congress sometimes. It's one of us going over there and literally knocking on their door and saying, come over and have a cup of coffee. It's not frightening. You will see that people love you and care about you. So we've pushed this section of society so far down that it's going to take a long time to get them back. And if I might, I've watched that movie now 3 times. It was forwarded to me early, so I watched it twice. And the gentleman who speaks, there's 2 things about that movie that are most pertinent to me. One is that it is a grassroots movement. It's not the government funding something that they think they can do a better job of. These are people who are addicts who are saying, we need to help ourselves because the people who are doing it are not doing it right. And I'm going to get in my high horse and tell you, if you trace that back to the 1930s when the first 12-step program started, and then all of them that came after, they're all grassroots movements. That's how they got some results with regards to this. And that's not designed to say the government doesn't have a role. It's designed to say that they can't fix the problem if everybody in this room and more are not involved in what goes on. The other thing that Ronnie said in there, he talked about hope and purpose. And that has to happen long before people are struggling with addiction. We need to start thinking about how we do that. So we should throw kind of the baby in the bathwater out and say, let's rethink the way we're doing this as opposed to the way we're doing it now.
Thanks, Mike. Once again, if you have a comment or a question, please come up to the mic. We'll bring that over to you. But I want to continue on. Mike mentioned the pandemic. Chief, we've talked a little bit before about the problem with this more potent and often contaminated supply of drugs that's out in the communities. But in your view, have you seen a spike that may have been related to the pandemic?
I believe this is coming. This is the way I kind of look at everything. Like, we have our drug addicts who are supporting their habit, and we're also running into right now large amounts of people from the cities, Utica, Syracuse, Rochester, coming to our area and bringing crack, cocaine, and fentanyl with them. And what they do is they prey on our drug addicts, they move into their houses, and they feed them cocaine to sell drugs for them. I can tell you, yesterday we did a search warrant on an individual we were looking for from Utica, and the young lady that's an addict, we brought her to the station, charged her, was back selling by 1 o'clock in the afternoon. So that's what we're running into. I don't personally play it into the pandemic, but that doesn't mean it's not. It's obviously part of the pandemic, but what we're seeing now is bail reforms coming into play in my picture, because we're arresting people from New Jersey for selling crack cocaine and fentanyl in our communities, and they're being released to go back to New Jersey, and not show up for court, or they're from Syracuse being released. That's our biggest problem right now, is how do we hold these people accountable and get the help for the people that are addicted, that are being used, which I've run into quite a bit I've been doing drug work for probably the last 20 years. It's always been my thing. And I've seen this numerous times, but right now it's the worst I've ever seen of these people from outside our communities coming here.
Thanks, Chief. Rheannon, we talk a little bit about the fentanyl problem. And in the film and elsewhere, you'll hear about the incredible potency of this synthetic form of opioid, and the correlating difficulty in breaking that addiction, because it is so powerful. What are you seeing, and what are some of the ways that you're able to either test or address it with your clients?
So
Not clients, your patients.
I think that Zach talked about a very visceral level, and I think that before we talk about all of the reasons why, we all know what the problem is. We know that people are selling drugs. We know that people are overdosing, and it's getting worse. And so that is the problem. The solution is love, and acceptance that we cannot make people do what we want them to. And so harm reduction, the easiest definition that I like is minimum change for maximum output. And so I want to first say that I'm sober. I've been sober for a very long time. I practice abstinence, and I'm also in a 12-step program. And so when I came to this job, it was very uncomfortable for me. It challenged every one of my morals and my beliefs and the foundation of my sobriety. I'm sure you all felt that watching this video. I felt it. I still feel it. And I still can't watch somebody shoot up without cringing. I give out needles. That's what I do. Because, I worked in the syringe exchange for about 6 months and felt like, I get this, and it makes sense, and we need to be doing this. My siblings are out there overdosing daily. My whole family's addicted. Everybody I used to be close with. I believe in it, but then doing it was so uncomfortable. And I would even think, like, what am I going to say to my kids, like their friends and their parents, if they ask me what I do? And now I proudly say what I do, because I stuck around. And just like the people that were working in that video, it got into my heart, because I've been sober for a long time to know that abstinence works, and it is your best chance at the best life you can have. But I've also been sober long enough to watch a lot of people die, and they didn't have to. At the end of the video, it said, not one person has died in one of these places. A lot of my colleagues are running sites like this in New York City right now, and the impacts and the outcomes are phenomenal. And so the judgment, the stigma, placing what we do for ourselves on other people, it makes them feel worse, it presses them down, and it marginalizes them worse. I have spent the last couple of years very ill, and the amount of times that people checked my arms for track marks is unacceptable. The way that I walked out of those settings is unacceptable, and I'm a professional, and I've got a beautiful life, and I still walked away feeling this big. So to me, we need to love people, and we need to embrace all of the models, because Jared and I work closely together in our professions, but we're also married. And we're the first harm reduction program and OASIS program in New York State to have partnered. And the outcomes for those individuals have been incredible. And then now we're partnering with Zach at St. Joe's for our second site in New York State. And I'll tell you, people respond well when you implement harm reduction into your settings.
So I want to talk a little bit about harm reduction, and obviously I think there's a lot of a range of emotions when you watch a film like this and deal with some of these issues about, you know, what should not be done. And I do want to get into that with each of you because I'm interested in your feedback on that. But I also want to talk a little bit about, before we get into that, a little bit about Narcan. And if I'm pronouncing it correctly, naloxone, which is really the generic term for Narcan. It's really one of the most effective weapons to combat overdose deaths. Are they readily available? And I'll open this up to the floor. Are they readily available in the North Country? These kind of kits?
Yeah, so our opioid overdose prevention program has, I think, somewhere close to 25 satellite sites, and St. Joe's was one at one point, CVFC is one, and so most of the Narcan, the Plattsburgh City Police, they carry our Narcan and they report any overdoses back to us. And so, yeah, you can get Narcan just about anywhere, but Alliance for Positive Health, we're located at 202 Cornelia Street. We can do a quick 5 to 10 minute training with folks and make sure people have Narcan, but also fentanyl test strips. Those are really good for the people that are using because they know what they're using before they use it. A lot of times people aren't trying to use fentanyl.
So let's talk a little bit. I'm
Can
sorry.
I just jump in and talk about Narcan? Because Rheannon came to our day business, which we employ about 75 or 80 people, and many of them are people that are in recovery or have struggled with addiction. And she trained all of our management staff and many of our regular employees and provided Narcan kits for all of us. And I would encourage anybody that's in that to do it. The training is not hard, and the understanding is there. The other piece is not every time, but oftentimes when there are events at MHAB, Alliance for Positive Health will come and provide Narcan training, I believe free of charge, right, Rheannon, to anybody who wants to be trained with Narcan. So I strongly encourage it.
This just also occurred to me. There was a lot of discussion about, you know, some folks who were veterans in the film who were having difficulty afterwards. Zachary, you have a wonderful program that is focused on the needs of veterans at St. Joe's. Has that been able to have an impact within the veterans community?
Yeah, absolutely. Enough? No, but an impact nonetheless, and something is better than nothing. But, you know, the reality is again, we're talking about a set of circumstances or life experience that's totally out of the norm. And when you share that with other people, you begin to create really strong bonds. And so that sense of connection, that sense of purpose, being connected to a unit, a squad, a platoon, whatever it might be, you never lose the desire to want that again after you step out of service. And so you're constantly looking for a tribe. And, you know, I think that's probably part of the most beautiful pieces of our veterans program is that the state has given us the opportunity to create a space and an environment that lets people find their tribe. And, you know, just talking on the Narcan side, this might come as a surprise, but a lot of service members seem to want to push the limits on things. And, you know, it's not just veterans alone, but Narcan, it's a life-saving substance. I'm not suggesting otherwise. But when you're struggling with substances that have such a short half-life like fentanyl, you know, individuals will be Narcan for enough time to go and use again. And there's a danger to that as well, right? And so these life-saving things that are coming out can also be double-edged sword. I'm sure the chief has seen similar things, right? And so, you know, that's something that the veterans have really helped us with, is giving us feedback of what they've experienced in other treatment episodes and, you know, in different environments and even on the streets and whatnot. Our staff will get rattled at some of the stuff that happens. And they'll be like, no, that happens every day. And it's just such a cathartic experience to recognize what normal means to someone. And so, you know, if Ronnie's normal, if that's what family is, that's what family is. And you know, I guess for the veterans, I digress a little, but that's what we're looking for. We're looking for a tribe, looking for a group of people we can identify and relate with, you know? And I think it's been a blessing to be able to create that and offer that to the state as a model.
So I want to talk a little bit about, you know, a lot of the film, in addition to dealing with, you know, issues of aloneness and isolation and how do you support folks. It talked a lot about, you know, this concept of an overdose prevention site, which is something that has taken hold in Canada. There's really only 2 such sites in the U.S., both in New York City. And I want to throw this open to everybody because I'm interested in your opinions on the pros and cons of these kinds of operations in terms of, on the one hand, harm reduction, on the other hand, it is, you know, a place where you're using illicit drugs. So I'd just like to get a little bit of feedback about if anyone has an opinion on these.
I'll save Rheannon from taking this one right off the bat. You know, it's taboo to talk about harm reduction when you're in a treatment setting. At least it was, because the problem is not a safe injection site. The problem is the con of it is image. It's not really anything but people have a problem with people using drugs, and if I can see it, it's a problem. It's not, obviously, there's nothing but upside to one of those places in the grand scheme of things. There's people, I mean, the statistic up there of 25 million or a million people dying in 25 years and nobody dying in 35 in one of those places speaks for itself. But I run a treatment program. Nobody uses drugs in my treatment program. It is abstinence. Mm-hmm. But I also know that people leaving are going to be using. Most of the people that come to my program will pick back up again. And so when you start to have an understanding that this goal we have of people never using again isn't going to happen, and some of them will make it and they won't pick up again, but I have found that treating these individuals with compassion, regardless of the plan that they have when they leave or the path that they take when they leave, is giving us the ability to continue to be a resource for them and continue to see them get another opportunity if they want it, or at least not walk out feeling like they were judged the entire time. And we have the Alliance come in and talk about safe using habits in our treatment setting. A bunch of people not using. And a lot of people will judge a treatment program for something like that, but we have accepted the fact that this is a very difficult thing to overcome. And instead of fighting against that fact, we lean into it, you know, and we've talked about connection and aloneness and what do we need. You know, Mike was talking about banging on people's doors and trying to get them to the recovery center, and these people don't want to come out of their rooms because when they do, they feel that judgment. They feel that stigma. And so it isn't about going to a AA meeting or not. It's more about, if I come out of my room, are people going to just love me for who I am, right? Because if not, they're going to stay in their room. And so it's not about this safe injection site or harm reduction so much as it's about, are we being compassionate to people? That's what we lack in this society, is we aren't compassionate
with people.
So when we talk about these ops, safe injection sites, I mean, we mentioned New York City, there's 4 of them in Montreal. But from a public safety officer's perspective, what's your concern about that, Chief?
Well, like hopelessness. I watched that video and I'm like, these people, there's hopelessness here. Why can't we have a methadone clinic, a Suboxone clinic, or caseworkers to help these people? And instead of every day, yep, I'm going to go down to the clinic and get high today because I know I'm not going to overdose. I have compassion for everybody. I treat everybody the same, and you can ask anybody I've arrested, I have compassion for them. If they came in tomorrow looking for $20, I'd give them $20. I would want to give them the help first before I'd ever want them to go every day and shoot up heroin. And where does the drugs come from? Where are they getting the money for the drugs? I mean, and the city's different than smaller communities as well. That's not like a lot of people in the cities, you know, they don't care as much as far as I'm concerned. Like, I would have a hard time with all these people like that. I'd want to get them help. Like, I wouldn't want them sitting on the street waiting to go inside and shoot up. But that's the way I look at it from a public safety. I'm not looking at I'm not looking at it as a safety for anybody in the community. Like, I don't think that's an issue. I'm looking at it as the poor people that are going in every day to get high and thinking that's okay, where I think we can at least try to get them some type of help. Next week, which I've been waiting for 2 years on this, is we're going to have a licensed caseworker embedded with our police department. So my goal is, like this young lady we had yesterday who's a crack addict, is to bring this guy in and try to get her the services that she needs. Try. Because when we used to, and I'm probably offend a few people, but when we used to put people in jail, people would get clean. And I can find people that will come here and tell me that, and tell you that. That's the goal for some of them, right? And they'll say, I got on the program, some counselors came in and started to see me, and I said to myself, I got to help myself. Now, when we arrest these people, they're back out, and they're not going to treatment because they have nothing hanging over their heads. You can't knock on their door and say to them, you need to report to treatment tomorrow, because a lot of them would say, no, I'm not, you know? But I have compassion, and I think that isn't as compassionate as I think, you know?
Thank you, Chief. Any other comments?
So I just like to I agree. I think that can be compassion. I think that all of it is compassion, and something that I experience a lot, especially in this position, because I'm the one doing the service that people are uncomfortable with, and I'm okay with that because I expect it. But I think that what I've found in communities where the people that are on this table come together and see the value in each of our models, where I can see the value in a police officer. I've seen people get sober because they got arrested. That's true, but I've seen many people get arrested, use in jail, come out, and then just go back to it. And that isn't because of any of the systems failing them. That's likely because of their trauma. That's likely because of their socioeconomic status. So I grew up very poor. We didn't have food. I have complex PTSD. So when they check my arms and they treat me that way, I feel like that little girl again that wasn't good enough. And that's what these people are experiencing. And I can't expect that everybody's going to be able to do what I did. I had to cut off my whole family. I don't have supports. It's a small town. I mean, there's just a lot of things that make it very hard for people to not want to escape. You know, if your dad would shoot you up and then rape you from the age of 7 years old on, I think that you might want to disappear too. And so when I work with people, I try to see the small them. I try to see, why are you like this? You know, what is getting in the way of of you becoming sober or you changing your life. And you know, I think that it's good that we're all having this discussion because people can hear that we actually do case management. We get people housing, we get people into rehab, they come back and then we get them into rehab again. Oftentimes, people get into recovery through a syringe exchange program. So within my program, I actually have a drug user health hub, because we call them drug users, not addicts. That's stigmatizing. And so we prescribe buprenorphine and then we get them to primary care or to an inpatient. So it's like the syringe exchange is the basic level, and then we can kind of start to help them become more stable so that they're not as unstable and having to stay there. But if that's what they choose, we love them until they're, because the other thing is why do we only care about them once they're sober?
Yes, Mike, and then
So
we'll go to
I
our
think
question.
I think that the beauty of these kinds of conversations are that you have a lot of different opinions and you recognize that one size doesn't fit all. I also am a member of the long-term recovery community, and I'm an abstinence guy, and I always have been in the decades that I've been here. And I had many arguments with Rheannon's boss, Diana, about harm reduction in the beginning. And what happened when I began to listen to her and she began to listen to me, we both softened up a little bit to the understanding. And that's what we need to be able to do when we have these conversations, is understand that there are strong opinions about this. I've not yet gotten to the place where I necessarily agree with safe injection sites, but I do understand harm reduction and all of those things. I'm just not there yet. And there may come a day when I get there and I think I understand the necessity of them. But I will go back to what I said the first time I spoke, which is this stuff is so much bigger than the things that we're talking about right now. If it's safe injection sites, are we opening up safe crack houses? What are we doing about the financial impact of the people who can't necessarily work because OSHA hasn't caught up with the laws that say we're going to allow people to use drugs, but we're not going to allow them to work in manufacturing facilities because OSHA doesn't recognize that. You have so many other problems that come into this that don't get talked about enough that are really the stuff we need to be addressing if you're going to do this. And as long as we don't address those things, the stigma that goes with this of the drug user is going to constantly be there. So society as a whole needs to either accept this or not accept this. But right now, we're not there. We're not, just take the marijuana issue. Legalizing marijuana, wonderful. People can do that if they want to. I don't agree with it. But legalized marijuana has crippled employers. Because if I put a guy on a forklift who is a pot smoker and he gets in an accident and causes an injury, OSHA comes into me and says, because the feds haven't legalized it yet, we're going to hold you accountable for letting somebody do that. And that's just one example. And all of these things are big pieces of the problem that we're talking about that have to be addressed in order to get to an actual solution for this.
Complex issues. Please.
Hello, can you hear me?
Yeah, can you introduce yourself?
My name's Tanya McPherson. I actually, I manage the Mary DeVoe Women's Sober Living House here in Plattsburgh, New York. And I know several of the panels. And I want to thank especially Rheannon because I just remember having a conversation with your husband in his office. And after tonight, I'm feeling how closed-minded I have been, but like Mike said, it has been a journey for me, and for me as well. I am also an abstinence guy, but I'm actually a female. I've been sober now for about 12 and a half years, and it wasn't easy. It was a lifetime journey for me, and I just love, I love love, and I love that you bring that up because being that I was in active use for most of my life. Yeah, I would say probably from 13 years old until 36 years old. And then I don't know if that was just when you brought up that picture of the little girl being shot up and raped. I'm sorry. I was not shot up and raped by my father. I had a very bad childhood. And people who are close to me in this community know that. Because I do believe that it's by sharing that what we go through, if we don't share, we have to share it to help the other people. And I guess what my point is, I'm actually very nervous. I've never done anything like this before. But I wanted to say, one, that I can admit that I've been closed-minded. And I want to open my mind to more avenues. Two, with my own experience, I tried I don't think it's considered harm reduction. I think it's considered maintenance when you do the Suboxone.
It's harm reduction.
And it didn't work for me. I abused it. And when I wanted to get sober 12 and a half years ago, I was still on Suboxone through an outpatient program here in Plattsburgh, and I asked my doctor if I could get off of it. And he told me he didn't want me to get off of it. And I felt very torn. And I went home and I flushed them because it was coming between me and what I knew I needed most, which was my connection to a higher power. A lot of people call it love in recovery. It was the hardest thing I ever did. I sweated, I ate, I wanted to throw up. I went to AA every single day, and I had people telling me I wasn't really sober. That even though I had been taking it as prescribed since the day I decided to be in sobriety, which was October 1st, 2010, I had people judging me and telling me that I wasn't sober. Furthermore, I have 2 degrees. In 4.5 years, 5 years into sobriety, after graduating, top of my class at Plattsburgh State, I couldn't get a job. I couldn't even get a job at the Red Cross. I got a phone call on Christmas Eve, I forget what year it was, probably 2014. One of my professors at Plattsburgh State, she did the child abuse and neglect class, and she was also the director of the Red Cross, the local Red Cross, and I cannot remember her name. She wanted to hire me as her assistant. She had to put the paperwork in. She knew my background. My background was living on the streets. What you saw in that film, I lived that life. I never did needles, but I was a crack cocaine addict, and I got a call Christmas Eve from a higher up in Albany saying that I couldn't even volunteer at the Red Cross because I had a misdemeanor. It doesn't matter what it was for. It was a certain type of misdemeanor. It wasn't even a felony. So I understand the stigma. I understand also that what kept popping up in my head when I was watching that film was I'm with Mike. I can't, I'm just not there. When I started reading about what the film was going to be about, I thought I was going to come here and be like, hell no. Excuse my language. But what I know from my own journey and from the women that I see where I work is that everybody's willingness comes at a different time. And who am I to say, don't stay alive until you get that chance? We got a girl, and I can't mention her name. I'm not really sure about HIPAA because I'm not under OASIS or anything, and I say that all the time to Jared, but we got a woman coming back to the Mary DeVoe house for the 3rd time. And after the 2nd time, I told her she could never come back again. But by the grace of God and love, how do I know this isn't her time, you know? And we're her family. That's what we do there. That's what we do, is we love the women so that they can love themselves. I'm sorry. Thank you, guys. Thank you. I didn't even ask a question.
Yeah. Jared. Thank you very much for that. Jared?
Yeah, real quick, Tanya, thank you for that. I mean, that was fantastic. I love hearing that you're starting to see something different. And I appreciate you saying that you're compassionate towards people and you want to see them get help, because that's refreshing to hear from law enforcement every time I hear it from somebody. And there's plenty of law enforcement professionals that feel that way also. I don't think it's a matter of that. I think those people are going to either use there or they're going to use at home, right? I mean, that's what we've started to accept and understand. And so the way that we're looking at them when I say that we're going to try to love or have compassion is we just accept that this is where they're at. But guess what? The people that go to Rhiannon's program trust her and that program more than any treatment professional they've ever been to. And it's because they do not have to filter themselves. They do not have to pretend to be something they're not. They don't have to worry about Rheannon telling law enforcement or their probation officers or their counselors are going to kick them out of treatment, or they're not going to, all of these different things. They just don't have that fear because they're just unconditionally loved. When the time comes that they're ready to get help, that's the people they turn to. So we absolutely need to be able to have an open mind to that, because they're building relationships better than any time I've ever built one in treatment, you know, so.
But it's understandable, the sort of resistance to that, because, I mean, even as we saw, there were people who were going and they were clients, and yet they were still using, and therefore we saw a very tragic overdose. So it's a complicated situation, isn't it?
Yeah.
And I really appreciate this conversation, because it is nice that everybody's coming from this perspective of compassion. And I think that, as Mike has pointed out, that is when you can maybe have some dialogue about what's going to make sense. Yes, sir.
Hi, Alex Clark. I live here in Plattsburgh and am involved in a harm reduction issue for an unfortunately siloed drug from the rest of this conversation, which is tobacco. But I did want to say, first of all, thank you to Mountain Lake PBS for rescheduling this, and thanks for the advanced viewing of the movie. And thank you to all of you for your work and service and showing up here to have this conversation. First of all, the author you were looking for is Johann Hari.
Thank you.
And
That's the one, write it down.
second, two of the things that I seem to hear the most about this issue is we have an epidemic of despair and trauma, and we have a poisoned drug supply. I think clinically people are dying of overdoses, but practically it is a drug poisoning. So with that in mind, I know that fixing people's despair and addressing trauma is an enormous task that I couldn't ask anybody to take on at the national scale. But as far as in the future, do any of you see the possibility of legalizing and regulating a marketplace for all drugs to deal with our supply issues? And I'll go back to my seat. Thank you.
I mean, I'll speak on that. I don't think that we're going to see that anytime soon because of the dialogue. Similar reasons to the dialogue we saw tonight is it's uncomfortable. It's completely different from what we're used to. I think that there's a lot of people who have been, maybe in treatment for a long time, or maybe in their whatever profession working with people, and I think sometimes it's hard for people to realize that maybe what they've been doing wasn't right. So there's just a lot. I think time is the answer, but I think that we're not going to get to that until we get to a place where we can legalize overdose prevention sites, which, I do think is coming, but even at the level that I'm at, next week is legislation education day, and I'll be at the Capitol talking to people about these things because I want them, and I know we need them, and I know that they're going to help. When people come into the syringe exchange, they come in with their head down, and most of them have been getting services, getting supplies from their friends get them, and then they bring them to them, and they've been waiting years to walk through the door because they're petrified. And when they walk in, and I treat them, and I just say, what drugs do you use? How often are you using? These kinds of things. They kind of, are like, wait, okay. And then it places you in a position to help them because they're actually telling you the truth. I can't tell you how many times people come into my syringe exchange, get needles, and then they go to Jared's program, and then they lie to them and say they're not using needles. So it's like, how can the counselor be helpful if the client can't say I'm shooting up? So I think that's a great question, but I don't see it happening anytime soon.
Thank you. Chief.
So I want to touch on a few things. Whatever happened to don't do drugs? Like, everything lies in poverty from what I see. Like, in my community, 18% of people live in poverty. That's despair. That's when they're little kids. That's when everything starts. It's very hard when somebody's 23 years old to change everything that's happened in their life. I just don't think, so now we've legalized marijuana. there's still going to be a black market for marijuana there because of the taxes and stuff. If you go to Malone right now, there's a big sign that says, "What goes good with tacos?" And it says Dank Bank, which is one of the shops on the reservation, which there are actually 30 of them right now. So what does a kid think when you drive by and see that sign? Now we're saying to everybody it's okay to smoke marijuana. Like, that's going to increase. Marijuana is going to increase. And I know people, I've talked to them myself, like, because I have a lot of confidential informants, that will say, I started smoking pot at 14. Now, this isn't everybody. I don't want to get everybody all upset, but and it wasn't doing anything for me at 17, so that's when I started doing the harder stuff. So I guarantee with the legalization of marijuana, there will be more people falling into that. It wasn't doing anything for me, so this is where I am. So now we're making marijuana, this is okay to smoke marijuana now, because that's what it says. If you drive down 37 towards Messina, you will think marijuana is the greatest thing ever. So when do we come back and saying, don't do drugs? Like, we lost our DARE program. We don't have any funding to go into the schools and talk to the kids. And, like, things are always good at school, but when they go home into their poverty, into their despair, where it all starts, that's where the issue is. Like, that's where the money needs to be put. And it just doesn't seem like we're ever getting anywhere on that level. Like, we see it every day that these kids are still living in these conditions where they shouldn't be living. And mom and dad are doing drugs, and the kids have no hope whatsoever. And family court now wants to keep these kids with their parents. So the problem is really deep, you know? And we can talk about legalizing marijuana or legalizing drugs, which I'm completely against, but there will always be a black market for that, and there will always be drugs people using that will be laced with fentanyl because they want the high and stuff. I was always told if you put out bad batch of marijuana or bad batch of cocaine going around with fentanyl, certain people will go, certain drug users will go looking for that because they want that extra high. So that's why we don't even do that anymore, because that's what happens, you know? I've told people, I've gone to their house and say, I'm sorry, your son died of a drug overdose last night. So that's why I'm a very anti-drug person, and I don't really care what anybody thinks of me, because that's the way I am. Because I've done that several times, and it's not very pleasant.
Thank you, Chief. Yeah, Mike, and then we'll go over to Dana's.
So you opened up a can of worms with that question. Thank you for that. We love people that throw something into the mix. And I will tell you, I'm probably a libertarian at my core, and I say if we really want harm reduction, full-on harm reduction, and we don't want people dying, then why do we have 1 million homeless people in this country? Why is the education system so broken? Legalize drugs and make safe places for everybody to go and use. Make a commitment as a society to pay everybody, whether they work or not, $100,000 a year that they can spend on drugs. That's real harm reduction if you really want to do something. But what we do as a society is nibble around the edges. And I'm not advocating what I just said. I'm just saying that we need to stop being so concerned about the, excuse my language, bullshit symptoms and things and all the stuff that we nibble around and figure out what we're really going to do about the problem. If the goal is to keep people alive, then throw everything at keeping people alive. And while I'm on my soapbox, I'll tell you, if you look at the OASIS budget, which is what's responsible for treatment and programs in New York State, the OASIS budget has better than 40% of it allocated to administrative costs. There's part of your problem. Put the money back in the hands of the people who can actually help the people get better, get the people off the streets, give them hope, and you'll begin to resolve this. But all we do is nibble around the edges, and we've constantly done that. And this forum will not change that. We will continue to nibble around the edges because our political leaders and the people who are in positions of power don't have the stones to do this, absent my dear friend Billy Jones, who I believe does, but the rest of them do not. And that's what really needs to happen in order to begin to really look at resolving this.
Thank you, Mike.
Can I just, I apologize.
Yes, yeah.
Please be patient with me, if you will. Just on a existential, spiritual level, we're talking about substance use and how to help people work through it, and we're talking about how to keep people alive long enough so that we can help people. People are valuable. Everyone is born inherently priceless in my books. And I got my director of spiritual health, Shane, sitting out there, who always reminds me of the importance of a compassionate presence, right? And we talk about stigma. and how do we help, and how do we help from here, and how do we help without, I don't know, a certificate in this stuff or training in this stuff. Recognize the inherent value in people and ask for their story. Share part of their story, right? We heard Ronnie in there's when the veteran was talking about how he lost his buddy, and he said, "Thank you for sharing, letting me carry a bit of that," right? That's how this works. Is we all carry each other's hurts, and we do that together. Mine would bury me, right? My boulder would drop me and bury me. But if I break it up and I hand it out, it's much more palatable. And so this is a yucky, messy conversation. It's political, it's polarized, it's got a couple of different, I would say even avenues in the conversation in terms of treatment and harm reduction and prevention, right? Are we trying to keep people alive or not, I think is like the crux of the question. And I think the prolegema, the beginning of that, the foundation of it is, are we worth saving? And I think it's an emphatic yes to all of us. And if we're able to look at it from there, then I think it actually allows us to be able to be a little bit more responsive to what do people need in that moment. And that might be hanging on to, old boy's wheelchair, or just giving a hug, or doing something that makes you feel uncomfortable, but is important to another person. And it's not easy, but I think it's simple. And it's got these layers that we've just added to it. And I think part of the conversation is kind of distilling it down to understand that what we're talking about is the value of an individual's life, right? It's not about what's legal and what's not legal. And by the way, there's legalization and there's decriminalization, which we never talk about. But that's a whole nother layer in our legal system that would actually help get people into care, and people that have ill motive that want to hurt other people, put them maybe where they need to be to keep other people safe. So we could go on and on about it, but I think the existential root here is are we willing to recognize the inherent value of each other, right?
Thank you, Zach. Dana.
Hi, my name is Dana, and I am an alcoholic, and I've been in recovery for quite a long time. I'm the product of a two-parent home, professionals, loving, caring, and my mom is a KSAC. She worked at St. Joe's in the family treatment program. Then she worked at Champlain Valley as our director of prevention services. She retired the day I started 22 years ago at the Family Center. And I'm not here on anybody's dime but my own, so don't accuse me of lobbying, Mr. Jones. But I'm going to just say that, I'm kind of glad that I got to stand here and listen to the three of you before I stayed, because I came up here to say that this problem goes so deep. And, there is an issue of poverty. There is an issue of parents who are working 2 and 3 jobs and children who aren't being parented, and not at anybody's blame other than it's just expensive to live today and we're not paying people enough. And, as someone who has watched prevention over the last almost quarter of a century in my life, these are some of the lowest paid people with master's degrees who are trying to make an impact on children before we get to the place that they're using or they make that choice. But I will say, as an alcoholic, there is this disease model too. And I don't have it anymore. I had a soul sickness, true soul sickness, and you saw it in that. And I agree, the hopelessness in that situation is hard for me to watch, because I do participate in self-help in the community, and it is where I found, through other people's stories, through other people's strength, through other people's experience, that I found hope. I could see a light, and I could see where to come out and what to do. And I just don't think there's enough available for our children way before. And I work in a tobacco control program where we start with them when they're 13, and I've said for 22 years we need to be starting when they're 6. And now with vaping, good Lord, we need to start when they're 3. And, you know, we really need to be working to support families in our community and children, and hopefully that could reduce. But it's not going to happen until we support those programs. You just mentioned Oasis, 40% is administrative. I don't know if any of that is right or not, but then I can tell you that the piece that's going to prevention is so small. If everything else is going into treatment, into harm reduction, into this, prevention is so little. And I would love to see us commit as a state more into our children and preventing this before we're stepping in intervention. So,
Thank you, Dana.
I do want to say one.
Yes.
So I went through the DARE program, and I value, it was really good for me. I think that, you know, I had a very unsafe home as a child. So it was helpful because I had adults around me, especially teachers. Honestly, teachers were the biggest angels in my life. But having healthy adults around me that cared about me was the most valuable part of that. But then I went back to my home, and those people can't go there with me. They can't save me there, and they couldn't stop my parents from teaching me how to use drugs. So that's the thing, is like, it's valuable. It's all valuable, but we fall through the cracks depending on where we're at or depending on what our situation is. So we need to value all of it. We need to value every single person up here and prevention, and we need to come together as a community and as human beings to care for human beings.
I just have one more thing I wanted to talk about, and it's, you know, we're really grateful to have such a great panel, because you're representing a lot of tremendous work that's being done on these issues throughout the North Country, and a lot of it is new. The new detox center, the new MHAB Life Skills Campus, the work that is being done by the Alliance and by Champlain Valley. There's a question of whether it's enough, and I would say that we would all say it's not enough, that there's other things that need to be done. But one of the things that struck me, and it's another Ronnie story, the guy was full of great quotes, but just his story about needing to step away from insight was also powerful. Whether you're providing harm reduction services or law enforcement and public safety or addiction treatment and rehabilitation, the work that needs to be done is often sad and exhausting and debilitating. So how do we keep people in these important roles who can, with sort of grace and humanity and empathy, can provide these needed services in the face of that kind of potential burnout? And I'll just throw that open to any one of you.
I can start, because I'm sure Zach will want to talk about this in a minute.
Thank you.
You have a very good perspective, is all I'm saying. Zach and I go way back, before we lost our hair. You know, I think that we don't do a good job. To the short answer of that is, you know, as people and every one of us up here are seeing traumas every day, you know, and it's impossible, you know, at least from my perspective, it feels impossible to prevent taking on some of that to the point where you feel it, you know, and our field in particular, the helping field, that goes for law enforcement to human services, is we just don't put enough focus on taking care of ourselves outside of our profession. And I know personally I've gone up and down through the years that I've been in my field where I don't take care of myself well, and I do, and we feel it, you know, and there's times that we like Ronnie needed to step away, that there's a lot of professionals that step away for the same reason, because they lose the ability to feel like they can take care of themselves while they're constantly trying to care and take on other people's traumas. And the answer to me is we need to stay connected, right? I mean, it's the chief was talking about his lens, and then Rhiannon's talking about her lens, and Mike has his lens, Zach has his, and I have mine, and it's all a little bit different, but it's like we're all on the same team, but we're playing a different position, right? They're all important. Every position is important, and if you take one of those out, we're not going to be doing a very good job, you know. But if we can realize that we all need each other, and we can stick together, and we can lean on each other and support each other and work together towards common goals from each perspective, I think that we'll find ourselves in a lot better position to deal with that kind of vicarious trauma. So,
Thank you.
Yeah, so if I can, you know, I don't think it's a secret, and if you don't know, you should know that workforce issues in the throughout the nation, but specifically in the human services field and the medical field is just ridiculously high. We need more people to be willing to help other people. And what I think what we've seen in the past, to Jared's point, is when you're able to create a culture that allows for some healing and allows people to come into an environment that is just as nourishing, you know, to their soul as it is to those that they're going to work and interact with throughout the day. That's been the glue, especially through the pandemic, that's kept, I think, you know, our workforce as strong as it has been. We're exhausted. We're like so overwhelmed that we probably haven't taken much time to sit down and think about it, because it would just overwhelm us more. So we're typically the kind of people that just keep go and go. Personally, you know, my career has been a series of movements throughout the agency that I have the honor of being a part of right now. That's kept me fresh, because every couple of years I go try and find out a whole new aspect of trying to help people in a different way, struggling with this, you know, a lot of the similar different symptomologies and whatnot. That's kept me energized. But, you know, it's more the relationships that we build, I think, because statistically speaking, it's not a very hope-filled job, okay? And that's terrible to say, but that's just the fact of it, is that we have to draw from different opportunities and wins that other people might look at and not perceive them as positives. And for us, we recognize them as growth, all right? So kind of speaks to the harm reduction. Real quick, if I can, at the Veterans Program, it's long-term residential. We'd have people there 18 up to 23 months, and they'd do phenomenal, incredible. You'd see their life change in that course of time, reconnected with family. They would successfully discharge or complete treatment, and they would call us within 24 hours in a closet because they had a recurrence and harmed themselves, and they were begging for us to take them back. And what we were saying at first was, what did we do wrong? What did we miss? But then we began to realize, wait a minute, it only went 24 hours, and they called us and wanted to come back. And all of a sudden, a failure turned into a win. And we started looking through a different lens at the paradigm of how do we identify success? How do we define that? And if treatment providers are just starting to do that, then it's reasonable to think that we have a ways to go.
Thank you.
Yeah.
Can I jump
Yes.
on and just address it? First off, can I be the quarterback, Jared? Am I the quarterback on the team?
not if we want to win.
You know, so I've been in recovery a long time, but I've only been working kind of in this field for the 4 years that we had MHAB open. And I will tell you that I underappreciated how hard it was to provide services to people that go to treatment or come into recovery. I opened this after being in recovery for almost 3 decades and said, everybody who comes from Jared's program or St. Joe's, they're gonna come, they're gonna go to meetings, they're gonna flourish, they're gonna leave here in 2 years living this wonderful life and have a job and their family back. And in a relatively quick period of time, I realized that that was not the case, that this is a much harder illness to battle and confront. So it was really eye-opening for me, and it's another one of those things that Tanya talked about. It's the journey of learning these things, that are different. But if you think about it, Dr. Silkworth, who's one of the first physicians who began treating addiction and alcoholism, made a comment that's in the AA Big Book that is about saying most medical professionals don't like working with alcoholics because they're too heartbreaking. This is heartbreaking. The burnout level in this field has to be incredibly high because the success rate of people getting their life together is so incredibly low. And that's not a knock on the people who work their butt off in the field. That's just the nature of the illness that we're dealing with. So it is very, very difficult and very heartbreaking to watch what goes on with regards to this. And I'll say one more thing before this gentleman speaks. I think it's profoundly nice to be sitting up here with a law enforcement officer and Rheannon Croy, who might be diametrically opposed to just about everything with regards to this, but I would not question either one of their compassion to help people survive and get better. And that's what we need to recognize. The view doesn't matter. The people up here are doing this because we want to help people. That's the reason why.
Thank you, Mike. I think we have time for one more question.
My name is Shane. I really appreciate all these perspectives. I notice we have an empty chair, and I would like to...
That's my chair. I just
okay.
never sat down.
I would like to name the person in that chair that may not be represented tonight, which is actually what this film is about, which is the work of peer support specialists. In the state of New York, we call them CERPAs, Certified Peer Record, and Certified Peer Support Specialists. What within each of our programs, and how can we continue to utilize and fund and resource and utilize the peers themselves within the field to address some of the gaps that we have?
Can I speak on that?
Yes, Rheannon.
Yeah, so peers have been used in programs like this. I mean, these types of programs began to actually combat the AIDS epidemic in the 80s, and they were underground programs because they're uncomfortable for people. But peers are a huge, huge part of this. So I mentioned a lot of times people don't come in for 2 years because their friends are serving them. Those are peers. So similar to the film, we have a peer-delivered syringe exchange model. And so what that looks like is we deputize our participants. We call them participants, by the way. Sounds a lot nicer. And that's what they are. They participate and they show up and they serve each other and they get into their communities and then they serve their communities because their communities trust them. And this isn't, this is a drug user health approach, but it's also a public health approach. So if sometimes the only thing people care about is that we're not spreading communicable diseases and people aren't ending up with more wounds, then that is definitely part of what happens from this. But the peers are instrumental, especially in the really hard to reach communities because they don't trust. And I keep thinking this and I keep forgetting to say it. And, everybody, including myself, watches this kind of stuff and says, wow, that's heartbreaking, that's so uncomfortable. But this is their life. And if they're not doing it in a facility, they're doing it in their houses. They're doing it in houses together, and they're overdosing, and they're not equipped like we are. So it's just bringing it out into the shadows. Just because you see it on the film doesn't mean it's not happening. Just because we open up a site doesn't mean it's not happening somewhere else. So yes, it's bringing this stuff out of the shadows, but isn't that what we want? Because if we keep it in the shadows, we cannot address it.
At MHAB, we have the Champlain Valley opened up the Recovery Center, which is effectively an all pathways to recovery place that's a drop-in facility manned by peer advocates, recovery coaches, 6 days a week, that's open at no charge to anybody in the public to come and find anything out about addiction, recovery, talk to one of these people. It's 100% drop-in. So I would encourage you, not because it benefits me, but if you want to talk to recovery coaches, they're on site 6 days a week just waiting for people to drop in and talk to them.
And Chief, I imagine you're partnering with entities in Franklin County on things like this to refer people to the right places.
We have the crisis center that opened up a couple years ago, so we're bringing people there all the time. And like I said, we're going to have a licensed mental caseworker. I don't know their exact title. They'll be starting with us next Tuesday or Monday. They'll be available to, like I said, if we have somebody under arrest, they have an addiction problem. My goal is to bring this person in, connect with them, and have them follow up with them as well. Like, not just one time. Like, reach out to them if they want the help, get them the help. You know, that's my goal. That's our goal. We're going to work with Community Connections in Franklin County for that. And after all the police reform and stuff, they didn't want the police responding to the mental health calls. So I've been waiting for these agencies to bring this stuff to us, and no one's brought it to us. Like, so we've still been handling all that, you know. And finally, someone stepped forward and offered this to us, and I think it's a great, great thing. And he came in, I'm like, absolutely, we're going to do this. And I think it's going to work out great, you know. And my officers have all been responded very well to this. So next Monday, hopefully things go well, and I think they will.
Good progress. I think we're going to probably wrap it up right now. I want to thank each of you for a great discussion, and all of you for being part of it as well. Rheannon, Jared, Zach, Chief Premo, Mike Carpenter. This has been terrific. This has been part of our Indie Pop-Up Lens series. We have 2 more of these coming up. February 22nd, Storming Caesar's Palace. March 29th, Free Call Sue Lee. And this is part of our ongoing commitment to the New York overdose crisis. We'll have a week-long series of programs on Mountain Lake PBS between February 13th and 19th. We invite you to tune in. Thank you very much on behalf of us and the Strand.